Alrighty, we're up to poster number 10. Predictions for extended length of stay, 30-day readmission and clinical outcome after fundoplication. Being presented by Yalini Vigneswaran.
Good afternoon. I'm happy to present our experience today. There are no disclosures. So readmission and length of stay have become measures of quality of patient care in medicine, and it's becoming more relevant in the surgical field. So we chose to look at these outcomes for a fairly elective, commonly performed procedure, a laparoscopic fundoplication. So in the practice of 2 surgeons, we did a retrospective analysis of these cases, exclusion criteria as listed here. And overall, what we found is that we had about a 7% rate of 30-day readmission overall, and extended length of stay defined as greater than 3 days, we had a rate about 17%. We additionally stratified these patients by those that presented for a refractory GERD versus those that presented with a paraesophageal hernia. As we can all agree, these are 2 different diseases. And we did not see any difference in the rate of readmission, but there was a significant difference in the rate of extended length of stay in those patients with paraesophageal hernia, having not only more patients with extended length of stay, but a greater length of stay. Not too unsurprising since these are more complex operations. Here's the median time to readmission. The most common reasons for both readmission and for extended length of stay were mostly related to cardiac or pulmonary issues, meaning mostly pneumonia, hypoxia, pleural effusions, arrhythmias, which was interesting. We then looked at what characteristics in these patients were particularly associated with these outcomes. We looked at patient factors, specific disease characteristics, and then operative factors. And what we found was that for 30-day readmission, that as follows, these in a univariate analysis, age, ASA class, fundoplication type, meaning Nissen versus a partial fundoplication, and then whether they incurred some kind of intraoperative complication, were associated with 30-day readmission. And for extended length of stay, again, age and ASA class, and then in particularly, like I pointed out earlier, having presented with a paraesophageal hernia. Interesting that the location to the LES identified preoperatively, and then whether they had a prior fundoplication, and if there was a hernia, and what type of hernia that was. Additionally, operative time and operative complication were associated. These univariate associations were entered into a multivariate analysis, and what maintained significant in these models was an intraoperative complication increased the odds of readmission by almost 30 times. That's not unsurprising, and that patients with a higher ASA class, meaning an ASA class of 3 or 4, also had an increased of odds of 30-day readmission. Extended length of stay, a patient who presented with some type of prior fundoplication had increased odds of extended length of stay, age greater than 80, and a longer operative time. So I know a lot of these are not very surprising. I mean, you would expect that patients that are sicker with more advanced disease, meaning they had a prior operation, or would incur an intraoperative complication. But I think this gives us some information of what patients to target. So it's clear that these patients are at higher risk for readmission or extended length of stay. And so it's really deciding what we can do to prevent this, and if it is even preventable. And I think there are places that we can improve, since most of these patients are coming back for some kind of pulmonary cardiac complication, whether it's precautions or encouraging pulmonary toilet in these specific patients, making sure they have early follow-up with primary care or even the surgeon. But I think there needs to be more studies to investigate this further in larger populations. Thank you.
Hi, Tom Watson, Rochester, New York. That's a nice talk. Do you have any data on your average length of stay and whether that decreased over time? The reason I bring this up is you may know Medicare no longer pays for a Nissen as an inpatient procedure. It's supposed to be an outpatient procedure, which to those of us who do it kind of blows my mind because you get a lot of these people who are in for long periods of time. And a lot of the national data would suggest that the average lengths of stay run about 2 days.
Yeah.
And yet we're supposed to be pushing these people out the door the same day. I guess I encourage you, and if you write a manuscript, to point that out.
Yeah, I think that's one of the important things of the study is there's certain expectations, whether they're realistic or not. Unfortunately, I don't know, and that's something that I'll definitely look at is whether the length of stay has shortened over time. But it's not something that I have off the top of my head right now.
Great, thanks.
Yeah, it's interesting though.